If you struggle with bunions or your feet are starting to move inward, especially your big toe, and it looks like you may develop bunions, this video is aimed to give you ideas on how to offset that from happening or help eliminate some of those symptoms once they have occurred. My name is Dr. Sarah Sewell. I am with Resilience RX, and we do physical therapy to help active individuals get back to doing what they love. And tonight we're talking about bunions. So a bunion occurs on the big toe when the big toe is moved inward. Technically, this position is called hallux valgus, and it basically means the big toe is angled towards your other toes. This can occur for many reasons. A lot of shoes, particularly women's shoes, have a small toe box, or high heels have a pointy end, and they shove all the toes together. Other shoes, men's shoes, can have a small toe box as well, and that puts more force on those toes, pushes them in. One of the other reasons for this developing, obviously there's genetics, but also due to wearing shoes, in general, we have very poor control of the muscles on the bottom of our feet. People just in general, whether you have foot pain or not, and one of the best ways to prevent a bunion from occurring or prevent a bunion from worsening or to help reverse some of the discomfort is to actually use those muscles of your big foot. So believe it or not, you have a muscle that actually brings this big toe out to the side like this. Now, I can do it about this much, and if you have a really good eyesight, maybe you can see that. In any case, I can feel this muscle activating, and this is that muscle. But from wearing shoes over time, it activates very poorly. This muscle pulls this toe out this way. That is a muscle that you want to be able to kick in and activate. Strengthen is kind of a dubious word, whether you actually can or not, because it's usually so hard to activate. But doing so helps reverse this and brings this out. If for some reason you struggle to activate that muscle, which is very, very common, you can push in on your toe. You're going to want to do this lightly because you'll very easily overpower it and force yourself to push out against it. In doing so, you may feel a burning in through here. So in through here, and that's that muscle working. It feels so burny because kind of like when you do a hard workout, your muscles get burny. It burns so quickly because it's not used very much at all. Another exercise that isn't potentially as beneficial but still very important for the big toe and bunions is the ability to isolate this muscle. So this is my flexor hallucis longus, which and brevis. But in fancy words, basically just means it brings the big toe down. That's essentially what it does. The ability to do this is key for those people with bunions because it helps develop some of the muscles underneath the bottom of the foot here to help stabilize that joint. Stabilizing the joint can decrease forces on the joint, make things more comfortable. A couple other tips just for everyday life is to, if you are struggling with bunions or you feel like you're about to get bunions or bunions are starting, is to find shoes that have a wider toe box. Because if you consistently reinforce that pushing together, it's going to be really hard to reverse that. Yes, a lot of the times they aren't as fashionable, but you can find some shoes. If you have questions on which ones to buy, feel free to reach out. I'm fairly familiar with ones because people ask about it a lot. You should, so a good rule of thumb when you're purchasing shoes in terms of a toe box, if you're struggling with bunions, is to get a toe box that's wide enough where you can kind of wiggle all your toes and spread them apart a little bit without them touching. So if you can't spread your toes apart and you're struggling with bunions, then at least for the majority of your day or the shoe that you're going to spend the most of your time in, you should get a wider toe box. Now, if you're going to work or you're going to a social function and you need or want to wear heels, totally fine. It's not something you have to adhere to 100% of the time, but it is something to keep in mind when you're choosing your footwear. So that is bunions in a nutshell. Basically, the big toe moves in. We want to move it out, and that involves giving it more space in the shoes we wear and activating those muscles on the bottom of your feet. If you are struggling with bunions or have any questions about the human body in general, I would love to answer them. Feel free to message me.